Hey everyone, following up on our recent explainer about the history of acupuncture, today we're going to dive into something a little more visceral. We're exploring the bizarre, the bloody, and honestly, the slightly terrifying journey of Western surgery. We are going to trace this wild path from medieval astrological charts and unwashed hands all the way to the flawlessly sterile operating rooms that we completely take for granted today. It's an intense history, packed with eccentric characters, some truly wild theories, and a desperate, centuries-long search for clinical cleanliness.
So let me ask you this right off the bat. Would you ever trust a surgeon who checks the night sky before deciding whether or not to operate on you? It sounds completely absurd to us now, right? But for centuries, this was literally the cutting edge of medical science. We have to understand that early Western medicine wasn't really based on anatomy as we know it today. It was this terrifying mix of physical invasion and cosmic alignment.
For centuries, a diagram known as the Zodiac Man was an absolutely crucial medical tool. Physicians truly believed that each part of the human body was ruled by a specific astrological sign. So, Aries for the head, Pisces for the feet, and the list goes on. The Golden Rule, which was attributed to the ancient astronomer Ptolemy, was that a surgeon must never ever touch a body part with a cutting tool if the moon was currently in the zodiac sign governing that specific region. Why? Well, because they believed the moon controlled the tides, and if they cut you at the wrong lunar moment, it would cause an uncontrollable tide of blood inside your body, leading to a fatal hemorrhage.
To really wrap our heads around why they were cutting you in the first place, we basically have to forget everything we know about infections. For over a millennium, diseases were viewed purely as imbalances of four humors. If you were sick, with literally anything from a mild headache to the bubonic plague, it just meant you had an excess of a humor, which was usually blood. So doctors relied super heavily on phlebotomy, or bloodletting, to literally drain the sickness right out of you.
But who was actually doing all this cutting? Well, originally, monks handled a lot of it inside monasteries, but in the year 1163, a papal decree came down forbidding monks from shedding blood. So who stepped up to the plate? The local barbers. Since they already possessed razors and a steady hand, they started offering a bit more than just a quick trim. They handled tooth extractions, bloodletting, and yes, even amputations. This is actually where the traditional red and white striped barber pole comes from. It literally represents the blood and the bandages of their medical trade.
Looking at how this evolved over the centuries, it's pretty wild. For hundreds of years, university-educated physicians considered themselves far, far above the messy, bloody business of surgery. They preferred to just observe and consult. It was the tradesmen, these barber-surgeons, who were officially tasked with setting bones and hacking off limbs on the battlefields. It actually wasn't until 1745 in London that the surgeons finally split from the barbers to form their own distinct professional medical company.
Okay, moving into our next chapter, the era of surgical speed.
As we hit the 19th century, which, keep in mind, is an era right before the discovery of anesthesia, the absolute best surgeons were not the most delicate or careful ones. No. They were the ones who were shockingly fast. Enter Robert Liston. He was this towering 6'2" Scottish surgeon operating in London, and the man was famous for his absolute theatricality. He would stride into the operating theater, often clenching his bloody surgical knife right in his teeth just to keep his hands free, and he would flamboyantly urge the gallery of medical students to "Time me, gentlemen," before he started slicing.
Think about it. Without anesthesia, the pain of surgery was unimaginable. Liston used straight blades and a very specific sweeping technique that allowed him to literally saw through a bone and amputate a leg in just 30 seconds. And honestly, this lightning-fast speed was a mercy. It minimized the patient's absolute agony, and crucially, it minimized the amount of time that an open wound was exposed to the filthy, infection-ridden air of the hospital ward.
But that kind of frantic speed comes with massive risks, which brings us to the famous legend of Liston's 300% mortality rate surgery. As the story goes, he was moving so incredibly fast during a leg amputation that he accidentally sliced off the fingers of his own assistant, and then on the backswing, slashed the coat of a spectator. According to the legend, the patient died of gangrene, the assistant died of gangrene from his severed fingers, and the spectator dropped dead on the spot from pure shock, making it the only surgery in recorded history with a 300% mortality rate. Now, while historians can't completely verify that this exact triple tragedy happened all at once, it absolutely captures the visceral, totally chaotic danger of the early surgical theater.
Which brings us to a major turning point, discovering the invisible killer.
While the visceral danger of the surgical knife was obviously terrifying, there was a much more sinister, completely invisible threat lurking right on the doctor's very own hands. Contrast these two horrifying death rates. Back in the 1840s at the Vienna General Hospital, pregnant women were literally begging not to be placed in the first clinic, which was run by physicians. Why? Because the mortality rate for childbed fever there was over 18%. But right next door at the second clinic run entirely by midwives, the mortality rate was only around 2%. A Hungarian doctor named Ignaz Semmelweis was desperate to solve this crazy discrepancy.
Semmelweis noticed one massive, glaring difference. The physicians were performing autopsies in the morning and then walking straight into the maternity ward to deliver babies. The midwives, however, did not do autopsies. Semmelweis hypothesized that the doctors were transferring these invisible, putrid, cadaverous particles from the corpses straight into the mothers. So he mandated that his doctors wash their hands in a harsh chlorinated lime solution before touching anyone. And guess what? Almost immediately, the death rate plummeted to match the midwife clinic.
He had the data, right? He absolutely proved that it worked. But in a profoundly tragic twist of history, the medical establishment was highly offended by the mere implication that a gentleman's hands could be dirty. Because germ theory didn't actually exist yet, they thought his ideas were scientifically unsound nonsense. Semmelweis was openly mocked by his peers, eventually committed to a lunatic asylum, and in a deeply brutal irony, he died at age 47 of septic shock from a wound he received from a beating by the asylum guards.
Right around the same time, during the Crimean War, British nurse Florence Nightingale was making similar empirical breakthroughs. She used groundbreaking statistical diagrams, like the polar area chart, to actually prove to the military brass that preventable infectious diseases caused by poor hospital hygiene were killing significantly more soldiers than actual Russian bullets. Her absolute insistence on simple things like ventilation, clean water, and just scrubbing the wards down drastically reduced the mortality rate.
So, that sets the stage perfectly for our final act, the antiseptic revolution.
Okay, so we have the raw data from Semmelweis and Nightingale, but the medical community still needed the actual science to back it up. The missing puzzle piece finally clicked into place when a British surgeon named Joseph Lister read the work of French chemist Louis Pasteur. Pasteur had just proved that invisible microbes caused fermentation and decay. Lister had a massive light bulb moment. If microbes in the air were causing surgical wounds to rot and gangrene to set in, he needed to find a chemical way to destroy those germs right inside the surgical wound.
Lister decided on carbolic acid as his weapon of choice. He mapped out these incredibly meticulous steps that he practically forced his highly skeptical peers to adopt. Doctors now had to wash their hands in carbolic acid. Surgical instruments sat in carbolic baths. He even used a bulky machine called a donkey engine to continuously spray a fine, choking mist of carbolic acid over the patient and the entire surgical team during the operation. Was it messy? Yes. Did it irritate the skin? Absolutely. But it unequivocally worked. Infections absolutely plummeted.
Just look at the massive shift here. It's night and day. Before Lister, a surgeon's coat was literally a badge of honor, often stiff with the dried blood and pus of previous patients. Instruments had these ornate wooden or ivory handles that just clung on to debris. The air was totally stagnant. Contrast that with today, where we have sterile bounds, high-efficiency particulate air filtration, and instruments that are perfectly sterilized in high-pressure steam autoclaves.
By the late 19th century, things evolved even further. The medical community realized that, hey, spraying harsh acid directly into an open wound maybe isn't the best long-term strategy. Thanks to innovations like sterilizable rubber gloves, which, fun fact, were originally introduced just to protect a surgical nurse's hands from those harsh chemicals, surgery moved from antisepsis, which is trying to kill germs already inside the wound, to asepsis, which is creating a completely sterile barrier to prevent germs from ever entering the operating room in the first place.
So as we wrap up this explainer, I want you to really think about this the next time you walk into a clinic or a hospital. Those flawlessly clean, brightly lit, highly regulated medical facilities didn't just appear out of nowhere. They were forged from a remarkably recent, incredibly dark history. It's a history literally paved with astrologers reading the stars to predict blood flow, local barbers wielding their razors, and brilliant minds who are mocked for simply suggesting a doctor should wash their hands. So, do you take the sterile scalpel for granted? Because it's worth remembering that millions of lives pay the price to ensure your surgeon puts on those rubber gloves today.